Today we celebrate World Club Food Day. It's a day set aside to recognize our children who have this deformity and have completed or are partaking treatment of club foot. It also recognizes the partnership of the people that care for these children and the non-governmental organization that support us in the catering of free treatment for these children. Once this outing was like a business meeting where all stakeholders that are involved in awareness campaigns and institution of clearing the ignorance that exists on treatment of this condition that is ravaging the society.
Food is one of the most common congenital musculoskeletal birth deformities globally. According to the WHO, it has been estimated that over 200,000 children are born with club foot deformity annually. I'm pleased to note that Delta State is making commendable progress in addressing these challenges through strong partnership with FNC and Asaba and other tertiary institutions to ensure these children are treated free of charge.
As the foremost body of pediatricians in Nigeria, the Pediatric Association of Nigeria stands in solidarity with you in advocating for inclusive healthcare, child rights, equitable access to treatment. We pledge to raise awareness alongside with you to commit as always to prompt referral of cases of club foot deformities to our colleagues, the orthopedic surgeons.
I tried to find out if club foot had a very loud voice in that policy, and if not, perhaps Delta State is going to be the first state to begin to speak to those things, those conditions that are not so loud, but are there, and they affect quality of life of our children.
Before we start it, we give training. Training is given by the NGO to the clinicians who are going to carry it out. So 2 trained people are actually expected to do casting for one child. So you must have at least 2 trained people to do the casting for the child. And then eventually, after like 6 to 7, 8 casts, depending on when the correction takes place, then we start bracing. Miracle Fit has been in Nigeria since 2018, and it has 5 partners. One of the partners is the one we are, the Straight Child Foundation, which is responsible for the treatment taking place in South, Southeast, and some part of North Central.
One of the problems that people have around our area is, apart from poverty, I think the ignorance is also there. They don't have the awareness. Even those with the awareness, somebody just mentioned about belief that we have. About different beliefs has also affected some of the things that we do.
Just like you mentioned, just to portray that point, that more awareness needs to be done, and so that more people will be aware.
Over 95% of children born with club foot can walk, run, and live fully functional lives. In our state, we remain committed to scaling up access to inclusive, affordable, and high-quality care for all children born with club foot.
I want to appreciate this Straight Child Foundation. We all need to support these children to access these services that are available in these 2 hospitals.
I can carry it to the market and I preach to them. When I will get children with, bring them out. Commissioner of Health wants you now, Asaba. We can arrange with Ministry of Health and we bring them. You see them and we know how to treat them.
To thank the state's governor, His Excellency, for this wonderful relationship. He has supported us in so many ways. Our nursing colleagues have been there, giving us so much support. We are very grateful. And also to say that the Federal Medical Center will continue to partner with the state government. Ultimately, we want to bring down to our people. We are serving the people of the Delta State. It doesn't matter whether it's federal or state. Ultimately, our patients are the beneficiaries.
We are also looking at going beyond the things that are ordinary or that are available to us and pushing for us to actually get support for these children with club foot. So we are very happy to be part of this.
I was very happy with her present condition, but I don't know what to call the hand, whether it's club hand, I don't know. You know, I really wanted us.
There are other intermediaries that are even willing to assist. The job is lessened. And we, on our part, will continue to partner with your agencies and the ministries to make this work.
The organizers of this Club Food Day celebration, thanking you all for all you have done so far to assist our deformed children back to normal state of life. I promise you that I will disseminate the information to the community of Muslims, because we have so many of them, I believe, among the community.
In all the markets, we have our coordinators, and after this meeting, I will also call them and give them this information. Definitely, they will go back to their markets and then look, because originally we didn't know that children living with this kind of situation can be helped. We have to let them know that our children will not be dying in ignorance. Whether you have money or not, you bring your children. There are people that are ready to help them to some extent.
These children have a deformity, and it's only a deformity of the feet. Intellect and learning are perfect in most of these children. So we should carry them and see how we can make an impact in them and then make them much better. I want to appreciate the state government, from the governor that has, and the Ministry of Health, who have painstakingly included all of us and brought us to a common forum to discuss ways in which we can carry this treatment to the troop, to the communities and beyond. It was a success, and we know that there's more that can come out of this meeting. Thank you, everybody, for being part of this glorious day.